All right, future nurses, welcome. Today, we are going to walk through a skill you will use all the time, both for your clinicals and out on the floor. How to properly help a provider get into a sterile surgical gown. Let's dive right in.
So here's what we're going to cover. First, we'll talk about the why. Why being sterile is so incredibly important. Then we'll get into the prep work, the actual procedure, how to finish everything up, and finally, what to do if you think you might have broken that sterile field.
Okay, so before we even think about opening a sterile package, we have to ground ourselves in the why. Because let's be real, in an operation room, the stakes are just incredibly high, and this is your patient's first line of defense.
When you boil it down, dependent gowning is really all about teamwork. It's a carefully coordinated dance between you and another provider, all to keep that environment totally sterile during an invasive procedure. It's how we protect our patients from dangerous microbes. This right here, this gets to the absolute heart of it. A tiny slip-up in your technique isn't just a whoops, it can directly cause a surgical site infection, what we call an SSI, and those infections can be absolutely devastating for a patient. So our attention to detail has to be perfect.
Let's talk prep. And believe me, proper preparation is way more than just having your supplies nearby. It is the absolute foundation for a flawless and, most importantly, safe procedure.
Now, I know these might look like really basic steps, but they are completely fundamental. Checking the record, getting your gear, making sure the patient has privacy, and identifying them correctly. These aren't just boxes to tick. They're non-negotiable parts of being safe and professional.
Okay, let's zoom in on two of the most critical safety checks. First up, allergies. You've always got to check for latex. And second, identity verification. You get these two things right every single time, and you're protecting your patient, your whole team, and the procedure itself.
All right, now for the main event. This is the core skill we're here to learn. We're going to break down all the physical actions into clear, easy-to-follow parts, so you can do this with total confidence.
So, your very first moves are all about control and keeping things sterile. After the provider has scrubbed and dried their hands, you turn your focus to the gown. And here's the key move. You create a little protective cuff with a neckline. This covers your sterile gloves, which lets you handle the gown without ever touching the sterile outside. Okay, once you've got your grip, take a step back into some open space. Let the gown just unfold on its own. Let gravity do the work. Never shake it out. Keep your hands up at shoulder level. Then you just present the arm openings to the provider so they can slide their hands and arms right into the sleeves.
This slide is so important. You need to have this mental map burned into your brain at all times. As soon as that gown is on, only a few areas are considered sterile. The front, from about your chest down to your waist, and the sleeves, from 2 inches above your elbow down to the cuff. Everything else, the neckline, shoulders, armpits, and the entire back is now considered non-sterile.
So the provider has their arms in, but guess what? We are not done yet. The gown has to be secured, and they still need to get their sterile gloves on. Right as the provider's arms are making their way through the sleeves, you just let go. Now this is where the circulating nurse, who is not scrubbed in, steps in to tie the back of the gown. Your final sterile job is to help the provider get their sterile gloves on, which completes that sterile barrier. Okay, let's talk about this scenario that every single nursing student worries about. What happens if you make a mistake? What do you do if you think something got contaminated? We're going to tackle this head on. This is it, the critical question. You're unfolding the gown, and oh no, it brushes against the table or maybe your arm. What is the correct professional thing to do in that exact moment? Listen up, because there is absolutely zero gray area here. This is the most important rule of all. If you have any doubt, even a little one, about the gown's sterility, it is contaminated, period. You have to stop, get rid of it, and start all over with a brand new, sterile gown. Patient safety is always the priority. So let's just do a super quick recap of the 4 key principles. Number 1, only the front of the gown is sterile. 2, use your sterile hands to protect that sterile outside. 3, keep a safe distance. And 4, the golden rule. When in doubt, throw it out and start again.
Mastering skills like dependent gowning is absolutely essential for your success. So, if this breakdown was helpful for you, please do us a huge favor and like, share, and subscribe. We're putting out new guides all the time to help you nail these core nursing skills for your exams and for your career.
And hey, for all of you who are deep in study mode getting ready for the big one, the NCLEX, we've put some links down in the description to our favorite summarized prep guides. They're a fantastic resource, for real.
So I want to leave you with a final thought to chew on. It might seem like a small, isolated task, right? But really think about it. How does your personal commitment to perfect sterile technique ripple outward? How does it help protect the safety and well-being of every single person in that hospital? Thanks so much for watching.